Let's speak now to Professor Naeemah Abrahams, who is the Gender and Health Research Unit Director at the South African Medical Research Council. Prof, thank you so much for your time this afternoon. Let's talk about this decline. Is it as a result of activism beginning to pay off?
I think so. We think it's a combination of programming, policies, activism, certainly women's movement that have tirelessly over many decades tried to bring about change. Maybe we're seeing social norm change, social norms in terms of how we view women, in terms of how we treat women, and also social norms in terms of use of violence. And there's a definite decline, and I think we need to intensify what we're doing and need to continue to work much harder, because we still have femicide, we still have a huge problem, but it's really encouraging to have seen that there is a definite decline. In 18 years, we have half the femicide in our country.
How much of a decline are we talking about here?
Well, in terms of rates, so that's the best way to look at it, because we take into account populations, growth. So in 1999, we had a femicide rate of 24 per 100,000 population. By 2017, that's 11.2. So that's more than half of a decrease. When we look at our intimate partner femicide rate, it's also halved. In 1999, it was 8.8 per 100,000. And now we're sitting at 4.8. So in terms of actual numbers, number of women killed per year, the numbers, if we look at it, we're still talking about more than 1,000 women killed per year in the country, but that number hasn't increased as our population increased. So in effect, it's a decline. Yeah.
I wonder, though, Prof, when we look at, the situation at police station level, it looks like there are still some challenges there, because some of, the families that go to report some of these particular cases say that they may either be met with police officers who don't really, take into account the fact that they're traumatized and there's not enough training in that particular regard. But there's also then the challenges around the investigations and sometimes the dockets that may go missing. I wonder, what did you find in that particular regard?
Yes, certainly. So that was with the one area that we found an actual decline in terms of quality. So what we saw, actually, there was an increase in the number of missing dockets. So this is where we start at mortuaries, so we know a woman has been killed. When we try and locate that investigation of that murder at police, we can't find a docket. Now, some police stations try their level best, and some really just tell us we can't find the dockets. In some places, we find dockets are filed there's no system. The dockets are just shoved into a room, and there is no way that the police can go into that archival room and find us the docket. In the other way that we found also that's worrying is there was an increase in where a case is investigated. There has been an increase from 18% to 30% of perpetrators or suspects not identified by the police. So in essence, we have seen there is less progression to justice for women that are killed. We have, because we just don't know how is it possible that particularly there's a 1 in 2 chance that a woman who's killed is killed by intimate partner, a boyfriend, parent or ex. Why is it that our police cannot collect leads, collect investigation to get perpetrators identified?
So listening to what, pardon me, listening to what you're then saying, can one then be correct to say that the decline you've recorded may also have face its own potential challenges, which may not necessarily be a decline if some cases are still subject to missing dockets, some of these perpetrators are not identified, and also the problem sometimes that we see when it comes to the reporting of some of these cases?
No, the decline is real, because first of all, we look at it in two ways. We look at all the women killed, right? So that's femicide. And so there we saw a decline. And then we looked at women killed by intimate partners. And so, yes, we do see an increase in perpetrators not identified, but it hasn't really affected the total number that we see. I think what we probably are seeing is that the decline is not due to police. Police hasn't improved their ability to bring about change for women and violence. The change came outside of the police system. It's structural issues. Maybe we're doing better at educating young women. They are able to be economically independent. Maybe we're doing really good at improving women's situation, but it's not police action that brought about this change.
Interesting there, Prof, as you say that this is not attributed to police, as they say they are also intensifying some of their fights. It shows that then there's a lot that needs to be done in that particular regard, but we have to leave it there. Thank you so much for your time. Some encouraging numbers, though, as Prof says that, there's still much that needs to be done on the police's side, but also when it comes to some of the investigations, but even bringing down in totality these numbers. That was Professor Naeemah Abrahams. She's the Gender and Health Research Unit Director at the South African Medical Research Council.